Hello and welcome. Today, we're diving into a topic that affects millions worldwide, diabetes. It's a condition that can seem complex, but we're going to break it down into simple, easy-to-understand terms. We'll explore what it is, how it impacts your body, and what you can do to manage it effectively. At its core, diabetes is a condition where your body struggles to manage blood sugar, also known as glucose. This sugar comes from the food you eat and serves as the primary source of energy for your cells. When your body can't regulate blood sugar properly, it can lead to a cascade of health issues. Imagine your blood as a busy motorway, constantly flowing and carrying essential nutrients throughout your body. And sugar as the cars, each one representing a unit of energy that needs to reach its destination, your cells. With diabetes, there's a constant traffic jam. The sugar cars can't get to where they need to go efficiently, leading to a buildup in the bloodstream. This excess sugar can then cause damage over time. High blood sugar, if unmanaged over a prolonged period, can harm your heart, increasing the risk of heart disease and stroke. It can also damage your eyes, potentially leading to vision problems and even blindness. And nerves, causing numbness, tingling, and pain, particularly in your hands and feet, a condition known as neuropathy. The real issue at the heart of diabetes is insulin, or rather, the body's inability to properly use or produce it. Insulin is a hormone that acts like a key, a vital component in this whole process. This key unlocks your cells so sugar can enter and be used for energy, fueling everything you do, from breathing to running a marathon. In diabetes, either your body doesn't make enough insulin, like in type 1 diabetes, or your cells stop responding to it effectively, a condition known as insulin resistance, which is common in type 2 diabetes. This isn't just about eating too much sugar, although diet plays a significant role. It's about how your body handles it, how efficiently it processes and utilizes the sugar you consume. Genetics, lifestyle, and other health conditions can also contribute. My goal is to break down the science simply, to demystify diabetes and empower you with knowledge, so you can make informed choices for your health, understand your risks, and take proactive steps to manage or prevent the condition. We'll explore the types of diabetes, from type 1 and type 2 to gestational diabetes and other less common forms. We'll delve into what causes them, examining the genetic and environmental factors that contribute to the development of each type, and practical steps you can take, including lifestyle modifications, dietary changes, and medical treatments to effectively manage your blood sugar levels. This is a message of empowerment, a journey towards understanding and taking control of your health, understanding your body so you can support it, providing it with the tools and resources it needs to thrive, even in the face of diabetes. By the end, you'll feel more confident and ready to make positive changes, equipped with the knowledge and strategies to live a healthier, happier life. So let's get started on this journey to understanding diabetes and taking charge of your well-being. Diabetes is a chronic condition affecting millions worldwide, and it comes in two main types that you should be aware of. Understanding the nuances of each type is crucial for effective management and overall health. The first type is type 1. The second, and often more prevalent, is type 2. Both type 1 and type 2 diabetes result in elevated blood sugar levels, but the underlying causes and mechanisms are distinctly different. Recognizing these differences is key to proper diagnosis and treatment. Type 1 diabetes is classified as an autoimmune condition. In this case, your immune system mistakenly identifies and destroys the insulin-producing beta cells located in your pancreas. This is a critical distinction, as it directly impacts the body's ability to regulate blood sugar. Without a sufficient number of these functional beta cells, your body simply can't produce the insulin necessary to process glucose effectively. And because of this, people living with type 1 diabetes require daily insulin injections or infusions to survive and maintain healthy blood sugar levels. This external insulin becomes a lifeline, replacing what their body can no longer produce. In contrast, type 2 diabetes is much more common, affecting a significantly larger portion of the population. With type 2, your body is still capable of producing insulin, at least initially. The pancreas continues to function, attempting to regulate blood sugar levels. However, the problem arises because your cells gradually become resistant to the effects of insulin. This is known as insulin resistance. Think of it like having a key insulin that no longer fits the lock, the receptors on your cells, preventing glucose from entering and fueling those cells. Type 1 diabetes cannot be prevented, and its onset is not directly linked to lifestyle choices. Genetic predisposition often plays a significant role. On the other hand, type 2 diabetes is strongly associated with factors like diet, physical activity, and maintaining a healthy weight. And in many cases, its development can be delayed or even prevented through proactive lifestyle modifications. Therefore, accurately knowing the difference between type 1 and type 2 diabetes is absolutely crucial for determining the most appropriate treatment and long-term management strategies. In the case of type 1 diabetes, the fundamental problem is a complete or near-complete lack of insulin production. Whereas with type 2 diabetes, the issue is not necessarily a lack of insulin, but rather that the insulin present is not working effectively due to cellular resistance. A clear understanding of your specific type of diabetes empowers both you and your healthcare provider to make informed decisions and choose the most effective course of care tailored to your individual needs. To gain a deeper understanding, let's take a closer look at the intricate relationship between sugar, also known as glucose, and insulin, and how they work together within the body. Every time you eat, especially when you consume carbohydrates, which are found in many foods we enjoy daily, your body embarks on a fascinating process, breaking down the food into a simple sugar called glucose. This intricate breakdown begins in your mouth and continues throughout your digestive system, ensuring that the complex carbohydrates are converted into a usable form of energy. Glucose is your main energy source. It's the fuel that powers your muscles, brain, and all the other vital functions that keep you going throughout the day. Once the food is broken down, glucose enters your bloodstream, ready to be transported to cells all over your body. As glucose floods into your blood, it naturally raises your blood sugar levels, signaling the next step in this crucial process. This rise in blood sugar acts as a signal, prompting your pancreas, a vital organ located behind your stomach, to release insulin into the bloodstream. Insulin acts as a key, a crucial messenger that unlocks the doors to your cells. It unlocks your cells so glucose can enter, allowing the energy source to move from the bloodstream into the cells where it's needed. Once inside the cells, glucose is used for immediate energy, fueling everything from your daily activities to intense workouts. Any glucose that isn't immediately needed is cleverly stored for later use, ensuring you have a reserve of energy to draw upon when needed. This storage primarily occurs in the liver and muscles, with excess glucose sometimes converted into fat for long-term energy reserves. In a healthy system, this entire process works seamlessly to keep your blood sugar levels balanced, preventing them from becoming too high or too low. It's a seamless dance between glucose and insulin, a finely tuned system that ensures your body has the energy it needs while maintaining stable blood sugar levels. This intricate process is happening constantly, every time you eat, working tirelessly to provide your body with the fuel it requires. However, in individuals with diabetes, this delicate dance is disrupted, leading to imbalances in blood sugar levels. This disruption can occur for a couple of reasons. Either there's not enough insulin being produced by the pancreas, or the cells in your body become resistant to insulin, meaning they stop responding to its signal to allow glucose in. When this system breaks down, glucose can't enter the cells effectively, causing blood sugar levels to remain high. Prolonged high blood sugar can lead to a range of health problems, affecting various organs and systems in the body. Therefore, understanding this fundamental relationship between sugar and insulin is key to understanding diabetes and how it impacts the body. Next, let's delve deeper and explore what specifically causes type 1 diabetes, a condition where the body's immune system attacks the insulin-producing cells in the pancreas. Type 1 diabetes is an autoimmune disease. Your immune system mistakenly attacks the insulin-producing cells in your pancreas. Genetics play a role, but having the genes doesn't guarantee you'll get the disease. Scientists believe a virus or other environmental trigger starts the attack in people who are genetically vulnerable. It's not caused by eating sugar or lack of exercise. The process is silent at first, destroying cells over months or years. Symptoms appear only when too few cells are left to make insulin. Type 1 is not anyone's fault. It's a complex mix of genetics and environment. Early diagnosis and insulin treatment are essential. Now, let's look at what causes type 2 diabetes. Type 2 diabetes is closely linked to lifestyle and environment, though genetics still matter. Being overweight, especially around your belly, is a major risk factor. This fat releases chemicals that make your cells resistant to insulin. Diets high in processed foods and sugar and low in fiber strain your blood sugar system. Physical inactivity makes your cells less responsive to insulin. Even simple exercise like brisk walking can improve insulin sensitivity. Age and family history also increase risk, but healthy habits can counteract genetics. Type 2 diabetes often develops slowly, but prevention is possible. Let's talk about practical steps to lower your risk. The good news, type 2 diabetes is largely preventable. Focus on a balanced diet, lots of vegetables, lean proteins, healthy fats, and whole grains. Cut back on sugary drinks and processed foods, swap soda for water and snacks for fruit. Regular physical activity is key. Aim for 30 minutes most days. Find activities you enjoy and add some strength training each week. Losing even a small amount of weight, especially around your middle, can make a big difference. Studies show losing just 5 to 7% of your weight can prevent or delay diabetes. It's about building habits you can stick with for life. Understanding diabetes is the first step. Taking action is what transforms your health. If you're at risk, your daily choices are powerful tools for prevention. For those living with diabetes, a full and vibrant life is possible with the right care and habits. Modern medicine and healthy living can help you control blood sugar and avoid complications. Think of healthy habits as investments in your overall well-being. Start small, be consistent, and celebrate your progress. Talk to your doctor, learn your risk, and make a plan that works for you. You're not alone. There's a community and resources to support you. Diabetes is serious, but with knowledge and action, you can thrive. Commit to your health today. The journey starts now.